What's going on, everyone? Welcome back to another Behind the Counter show here at HB Pharmacy. I'm with John, who is one of our owners and pharmacists here at HB Pharmacy. And today we're going to be talking about vitamin D. This may seem like a, maybe trivial is not the right word, but kind of like a, I know about vitamin D kind of topic. But we've actually been getting a lot of questions about vitamin D on social media here at the counter because we've been talking about it a lot since it's the winter, right?
Yeah, and I think it's our product of the month, actually.
It is indeed our product of the month right now, actually.
You know why vitamin D is so important and why it's the center of so many conversations when we're talking about our health is that you need a good level of vitamin D in your body to help absorb nutrients and assimilate nutrients. Like, for example, calcium and phosphorus into your bones, your teeth. It's very important for that. It's also important as a help for immune support. And
particularly important right now, obviously, with everything going around.
Right, sure. Yeah, it's been people have been very sick. But immune support, and then also in part to a lesser extent glucose metabolism, among other things. So it's a very important supplement.
Sure. So, you mentioned that it's been our product of the month, which it is, and we've been getting questions about, well, can I test for these kinds of things, or what's an appropriate level, or how do I know if I'm actually deficient in vitamin D? So first of all, you can do that in your physical, and there are some blood tests that can do that, but ignoring that, what is an appropriate level of vitamin D that you would look for when doing one of those tests?
Sure. So you have to know, too, when you go to the doctor and you're like, oh, my physical and stuff like that, they don't routinely include vitamin D in your panel, right?
Okay.
As automatically included. The doctor has to kind of indicate, or your nurse practitioner, that that's what you need. Now, labs vary with their normal ranges. We all see our lab reports and we can say if it's high or low and all that, and then the range. Typically, your normal in labs is 20 nanograms to 40 nanograms. They also measure it sometimes in millimoles, and then that range is different. What I would like to point out to you, though, is, and this is recent information from a lecture I just attended in November, if we're measuring it in nanograms, and between the 20 and 40, if you're in that range, you might presume yourself okay, and the doctor's going to tell you you're okay. What the latest literature is showing is that the healthier range for you to be optimally absorbing all these nutrients is much higher. It's somewhere between 40 and 80, really, or 50 and 80. So, look carefully at your labs. Ask the doctor, make sure that they do run that test, but know that those limits, when they say that it's normal and everything's fine, it still may not be enough.
Yeah, we've seen that with other supplements and not supplements, more vitamins and things like that. There's a difference between functioning and functioning optimally. Right. So obviously.
Yeah. So that 20 to 40 is a bare minimum. Is that's the thing.
So obviously we have some solo vitamin D products, if you will.
Sure.
But there are also plenty of products that have vitamin D in them, whether it's a multivitamin or particularly bone support vitamins have those as well, right?
Yes.
Why is that?
Well, again, because as we mentioned at the outset here, vitamin D helps. The calcium, if taken alone, it doesn't absorb and always assimilate into the bones and absorb properly. So you need some vitamin D on board to help it to optimize the absorption of
So should
calcium.
we always take those two together then, I guess? Is that important to always take together, calcium and vitamin D?
We certainly need vitamin D, as we discussed. Calcium is important for a lot of reasons as well. In my view, perhaps a better combination is vitamin K and vitamin D, because you'll still need the calcium, and some of these things. Keep in mind, we always try to, if you eat healthy or eat right, you try to eat some of these foods that are rich in these types of vitamins too. That's one way to do it. But I think vitamin K might be a little bit of a good option as well.
I think the analogy I always heard is like, if you think about your body as a concert venue, I believe, correct me if I'm wrong, but I believe that vitamin D is kind of like your ticket into the venue. So it's kind of like, okay, I'm taking this from my bloodstream into my bones, right? The vitamin D is your ticket. Then the vitamin K, or K2 specifically, is saying, okay, where are you sitting? Yes, you got into the venue. Now, am I putting the calcium? Calcium's got to go into your bones, right? So then the vitamin D gets, you into the venue. The vitamin K tells you where to go specifically. And when I say you, I mean the calcium in this case, to help correctly transfer the calcium into your bones, and then put it in the right spot where it
Exactly.
needs
I
to be.
think it's a good. Yeah, it's kind of a neat analogy. Yeah.
So now I know we've also talked about other things, what vitamin K, but what else is, you talked about diet. Where else can you find vitamin K in your diet?
Well, I mean, we have to keep in mind too when we talk about vitamin K. Some people are like, well, I don't want to mess around with this because I'm on some blood thinners and stuff like that.
Sure.
But that's K1 more. So when we're talking about supplements, we're talking about vitamin K2. Just like typically when we talk about vitamin D, we're talking about actually vitamin D3, right?
Right.
So, you can get. With vitamin K, where's there things?
Vitamin K, vitamin D, any of the above.
Yeah, I mean, so vitamin K, certain meats, red meats, certain fermented products that have it in there, certain green leafy vegetables like Brussels sprouts, maybe kale, things like that.
Okay. Okay. And then what about vitamin D?
Well, that vitamin D, our easiest way to get that is during getting the outside and getting some sun. That's probably your best way to get it. Obviously, it's 10 degrees out today.
Yes.
So we're not getting a lot of sun. But so that's better than that's usually better during the.
So that's related to some of the questions we've been getting here at the pharmacy and on social media. Is okay, how do I know I'm deficient in vitamin D, or like shouldn't I test for those levels? And you 100% can test for those levels.
Yeah, we can actually get vitamin D3 tests for patients, for not a lot of money. If they want to inquire about that, we can put a link.
Okay,
on
that's
there.
good to know.
Yeah, but I mean, if you're eating,
that,
you could eat salmon, egg yolks. There's other things that are.
But really, you need the
D3.
Sunlight. That's kind of where it's going to convert the majority of.
That's the optimal thing. I mean, forget about vitamins. Forget about the food. If you can get a little bit of sun.
Now, depending on where you live, this time of year, as you alluded to with the cold, is difficult. So there's a line called the 37th parallel, and essentially this time of year, call it end of fall into spring a little bit. If you are above that line, you are at a much, much higher risk for vitamin D deficiency. And that line is kind of like the Virginia-ish area. So if you're above Virginia on the East Coast, we're in New Jersey, obviously above Virginia, you're at a high enough risk for vitamin D deficiency that we tend to recommend this for all of our patients because there's a good chance you're not getting enough sunlight to convert to enough vitamin D. Of course, you can still test for that, but that's why we recommend vitamin D, especially this time of year.
Yeah, during the winter, it's probably a safe bet that you're probably dropping down low to whatever you're regularly at. You're going to probably drop down lower.
Sure. Now, you mentioned something else you wanted to bring up, a calcium score test as well.
So it's that's why I was trying to emphasize why it's important to take K2 because getting calcium-rich foods and getting all that calcium into the bloodstream, even if with vitamin D helping to get this calcium into the bloodstream, it's not enough because what happens while you take vitamin K is you want to get that the calcium out of the bloodstream, out of your arteries, and into your bones, into your teeth. What you may have all heard of sometimes people that have heart conditions and are at risk for heart attacks get this calcium CAT scan kind of thing, and they do this thing called a calcium score. So it's not always covered by insurance, so not everybody gets it. But the reason why you do that is because they're examining your arteries, particularly in your heart, to see how much calcium has built up in your arteries, because that puts you at the higher the score is, the more at risk you are for a heart attack. So it's actually very, very important to get that calcium out of your bloodstream.
Right.
Keep your arteries clear. So that's benefit number one. Benefit number two, it's out of the bloodstream and now into your bones where it belongs.
Sure.
So it's a big benefit.
So that goes back to that analogy I mentioned earlier. So again, just to reiterate, since we're on the topic again, think of calcium as you with a ticket to a concert venue. Your calcium needs to get to its seat, but first it's got to get into the venue. The vitamin D gets it in the venue, and then its seat would be out of your bloodstream and into your bones. That's what K2 does.
Right.
So vitamin D gets it into your or out of your bloodstream, and K2 gets it specifically into the right place in your bones. So yeah, that's kind of high level here. And I know you mentioned at the beginning.
Yeah, we have some products here too. In general, though, and these numbers went up. It used to be people used to take, products came with 400 units of vitamin D.
Sure. Yeah.
Now then we started recommending 1,000 or 2,000 units of vitamin D. I would say to you that minimum 2,500 to 5,000 units daily of vitamin D, Or we have a special product. This is D3, which used to be like on prescription. This is 50,000 units. You would just set up and take this once a week. But that would be the normal. That's where I would go with the vitamin D, to support. But
yeah, even this K-Force we have here too. This has 5,000 IUs of
right,
vitamin
and then
D
you
in
can
it,
take
which
that
is a
every
combo
day.
product.
Right, and then for K2, you want to get a product that has somewhere between 100 micrograms to 300 micrograms, and this, I believe, this is 180 micrograms,
Right.
so it's right in there. You got a great product there with that, and that's going to keep your heart healthier because you're getting rid of the calcium in your heart, and it's going to keep your bones better too. So a combination product like that's is a good thing to do.
Absolutely. And this time of year, again, given the fact that it's so prevalent, vitamin D deficiency or risk for vitamin D deficiency, we have a product of the month special that we do around now on vitamin D products as well. So if you're interested in learning more about that, feel free to give us a call at 201-997-2010 or shoot us an email at pharmacist@hbpharmacy.com. We're always here and happy to answer any other questions you may have. Is there anything else you'd like to add?
Just make sure you ask your healthcare practitioner to draw your vitamin D level, especially this time of year. If you happen to be going in, I think it's a good idea. You'd be surprised to see what your score is. Thanks so much. We'll see you next time.
Thanks for attending, everyone. Have a good one.